All right. So thank you, Justin, and welcome everyone to today's Lunch and Learn series. Today is April 16th, 2021. My name is Ronald Piaseczny. I am the president of Niagara Pride, and I am very, very happy to welcome a number of individuals who will be presenting today. We have Ben Stump from Social Security Administration. We also have, let's see here, whoops, I'm missing my notes. Oh no, we have Alan Booker from Booker College Planning. I'm going to be, this is going to be really bad. I completely apologize. I lost my sheet here. I have Cassandra Jackson. Cassandra, you are from Niagara Falls Memorial Center. Beyond that, I forgot the name of your program. It's I know you're hoping that I get it. It's not coming to mind. So I'm going to let you introduce yourself when the time comes for the full name of your program, but you are affiliated with Niagara Falls Memorial Medical Center. And we also have Anaya Wood from Evergreen Health Services. So they will be presenting today. They are our guest presenters. Each one will be doing about a 5 to 10 minute presentation talking about the services that they offer, after which we will do breakout rooms. So if there are any individuals on the call that have more specific questions for our guest panelists, they will be able to ask those individuals about the services that they offer and in a more one-to-one kind of setting in a breakout room. And then we'll also wrap up today's session with some announcements with regards from Niagara Pride, some upcoming events so that everyone is aware of what will be coming up in May and June. So with that, and because I don't have my list, and I put Ben on the, I said Ben was going to go first, but I will not call on Ben to go first. I will not do that to him. I believe, if I remember correctly, I think it was Cassandra may have been first on the agenda. So Cassandra, if you'd like to unmute yourself and tell us about your program, we would love to hear about it.
Well, good morning, Ronald. Thank you so much for allowing us to be here today. So I'm actually co-presenting with my partner, Brian Archie, who does the breast and prostate peer education. So we really kind of didn't really know exactly what we would needed to provide today. So we probably are just going to just talk a few minutes on what our program does and what we do in the community, and then just a few facts and some symptoms on certain cancers as it relates to breast and prostate. So we are part of a program that's called the Breast and Prostate Peer Education Program. It is a grant-funded program through the New York Department of Health. We've been around now about 4 years. We're in our 5th year, grant year, and we just got the great news that we are going to be extended for another year. So we're excited about that. You know, hey, we're glad about that. So, and Brian and I'll speak a little bit on breast, and then he'll speak a little bit about prostate. So basically, we know that everyone has heard or been or knew or know somebody who's going through cancer, went through cancer, maybe just coming out of it. And so one of the things that Brian and I do, we educate men and women about the importance of breast and prostate screenings as it relates to getting their screenings, talking with their doctor, also teaching and helping them to be aware of their screenings, and helping them to, as we know with COVID being like it is now, we're trying to help to link people back into the healthcare facility to let them know that it is safe to return. I did have some slides to show, but I think that I'm just gonna talk a little bit about the symptoms, and then if we break out in the breakout rooms, then I can probably elaborate a little bit more. Would that be good? Okay. So breast cancer, it does start when your cells grow out of abnormal. They grow abnormal. Right now, your body is doing what is called the apoptosis. You are developing new cells and getting rid of old cells. And it's when those cells do not operate right, then cancer forms, and you hear things such as abnormal tumors, which are mass could, or they could be either malignant or benign. Um, for breast cancer, some of the symptoms and risks are lump under the arm or in the breast. You having some type of irritation, some type of things going on. But we know that cancer, if you have any personal history of breast cancer, that can put you at risk as well too. So if your immediate family member, your mother, grandmother, if you fall in that line, you want to be talking to your you want to be talking to your family about any type of diseases that exist in your family, because again, the more we know, the more opportunity we have to access care and just to know more about what's going on within ourselves. We teach people how to do breast checks, um, as it relates to checking your breast and making sure that you are doing the right things as it relates to finding those lumps and those symptoms and things like that. So I want to talk a little bit about briefly about just really quick, because I have my PowerPoint slides, but it's all right though. So for a female to male chest surgery, so what that involves, it involves removing excess of skin and underlying breast tissue. And for those who are transitioning from female to male, they're still are at risk, which Brian will talk a little bit about, is still at risk for prostate cancer as well. And the same goes for a male transitioning to female. We want to make sure that you get the education as it relates to that too, because as long as you still have, if you have not transitioned all the way over, you still will be at risk because of the hormone replacement therapy and things that take place when you're transitioning. So also, some resources. We do a lot of work with American Cancer Society. They have a lot as it relates to the LGBT community. So I would also refer people to that as well too. The Healthy Link as well. And I think it's a great idea, Ronald, that you're putting the the directory together, because there's a lot of things that I can help as well too, is to kind of link you to some places as well too. So without that, just want to just say that. So in the breakout room, I'll elaborate a little bit more if somebody shows up in the break room. Thank you. And Brian, you're next up. Get your 2 minutes.
Listen here. All right. Good afternoon, everybody. My name is Brian Archie, and again, I'm a peer educator with Niagara Falls Memorial Breast and Prostate Peer Education. Thank you for the opportunity just to speak for a few minutes. And for my portion, I do specifically focus on prostate cancer. And so, in conversation, those assigned male at birth, right, are at a huge risk of contracting prostate cancer. And we look at it as in New York State, and this is where our information comes from, is the second most commonly diagnosed cancer, only after skin cancer. And it is the second leading cause of death, right, in New York State. And again, this is only after lung cancer. The prostate itself is a gland which is part of the male sexual reproductive system. So I state that, anyone that is assigned male at birth or is a trans woman, right, and you have not fully had transitional surgery, there is still a prostate there, right, and there is still an increased risk, specifically if you are of African American or island descent, of you contracting prostate cancer. As Cassandra alluded to, there are many different causes as to why our cells grow out of control and become cancerous. I'll speak specifically about Niagara Falls and just say that we can point to pollution as an immediate toxicity to our bodies. The air that we breathe, the water that we drink, some of the foods that we even eat, right, will increase the propensity for us to get some of these diseases. But there are some things that we can do which are across the board to allow ourselves a chance, and I just call it a better chance at life, right? And the first initially is to have a primary care doctor. Many of us, specifically in the LGBTQ community that I have spoken to, have issues finding a provider that actually pays attention and listens to what our specific needs are. Men, those assigned men is at birth, don't like going to the doctor at all. And again, I'm just going off of conversations, right, that I've had doing these presentations. We have issues with speaking to others in regards to what problems we have. So I say first is to find a primary care provider. And if there is one that is not sensitive to your needs, cancel that person out and find somebody else that is. Second is definitely, a healthy diet. And by that, I mean, we need to monitor, this is for me, the amount of red meat that we intake and kind of balance that out with some fruits, vegetables, and grains. With that comes some exercise, right? I'm gonna pick on Alan Booker here for a moment. I think I can do that because we have a long-lasting relationship, and Alan has never been out of shape that I have ever seen in my lifetime, right?
I just had to unmute that.
Right? Which means that we pay attention to our body and what it looks like,
Yes.
and how. I know you're gonna be laughing, and just again staying in shape and staying in good form. That means being active, right? Taking walks 20 minutes a day. It increases our cardiovascular health, our heart health. It stops some of the other diseases that we can contract, such as diabetes and heart disease, right? Um, we want to make sure that if we are a smoker, right, again, let's not add to what we can get, let's try to take away. So if we are smoking, let's do our best, to maybe, smoke a little bit less. And there's a specific word that they use that I don't really like, and it says that if we feel that we are overweight. I'm probably overweight for my size, as it's clinically noted, right? Because I'm 5 foot nothing and I weigh 170 something pounds. I'm not being modest, this is the truth. And a doctor would tell me I'm obese. I'll say that if your knees and your back hurt when you move around, we may need to shed a couple of pounds. I like cookies. I have a problem with that, right? So again, this is paying attention to what we eat, how we move around, and how active we are. Some quick symptoms with regards to prostate issues, and again, this is not prostate cancer, but just having issues with the prostate. There's a frequency of urination, typically at night. There may be even an inability to relieve oneself when going to the bathroom. Um, Sexual issues in terms of not being able to hold an erection and/or perform. There is pain in the back, pelvis, and/or hip area, which is typically on a constant basis. There's blood that may appear in our urine and/or our semen. So again, it comes down to knowing our bodies, knowing what they look like, what things that are kind of normal for us, and what's out of the ordinary. How can we combat this? Again, seeing the doctor and having them, if we are in the age range, which they state is, in the 55 to 69 years of age, unless we have a family history of prostate cancer. And I'll add, my coordinator's here, but I'll add any cancer. We need to be knowing that family history, right? And being looked at 10 years prior to that closest family member. So again, for someone assigned male at birth, your father, brother, or son, if they have had prostate cancer or have had prostate issues, you want to be having that conversation with your primary care provider. As far as I know, and just dependent upon insurance, if there is a need to see a specialist, and I usually send people to Western New York Urology, you can be a self-referral. So if there are things that are of question to you, you contact them up and make yourself an appointment. The screening, right? So how does that occur? The PSA, which really stands for prostate specific antigen, it is a simple blood test that is given by, primary care providers. If you are having a yearly physical, that test should be occurring. However, a doctor or physician or whomever is reading those results may not even address that with you if you are not in the age range of being someone that might have prostate issues or prostate cancer, which again comes back to the educational piece and us knowing, our bodies and what we should maybe be being alerted to. In our other presentations, information is altered specifically for what audience that we have, right? So typically when I'm speaking with men, I will emphasize the fact that African American men are at greater risk than our white counterparts of getting prostate cancer. I am 47 years old and I am a prostate cancer survivor, right? This is something that happened to me. I was just turning 43, well outside of any information that a doctor would give you as to being eligible to get this disease or eligible to have the conversation. And had I not had some things going on in my early 30s and been, a little bit aware of my body and having the intent enough to go to a doctor about that, I probably would be, on my way to the grave at this point. So I will close up and just say that, again, it's about education. It's about being connected to primary care that we trust, and that's engaging with us, meaning that we as patients are a part of the care team and being treated as part of the care team, which means, again, that there are some things that we'll have to do, right? We can't wait for, I don't like being talked at. I don't like for you just to give me directive without at least, she'll tell you, asking me some piece of input, but that's how a team works, right? So we're part of the care team, and we can only do that if we're informed and educated on what we should be asking and going to these medical systems with, to make sure that we can live to see another day. So again, I will hang around here, and if there are any other questions that I can specifically answer or resource that maybe I can direct you to, I would be glad to do so. Thank you, everyone, for your time. Thank you for listening, and blessings upon your day.
Awesome. Thank you, Cassandra. Thank you, Brian, for presenting that. That was really good information there. So I'm grateful that you guys came on board to present that today. Our next speaker will be Ben Stump from the U.S. Social Security Administration.
Okay, I just did that *6 thing. Can you hear me?
Yes, we can hear you, Ben.
It's always good to check before you get too deep into this. Also, I want to start by saying I work for the federal government, and we have these restrictions against video conferencing. So I'm not seeing anything that you all may be seeing, but Ron has graciously offered to present my slideshow presentation. Are you seeing it?
So Ben, I thought you did not want us to present your slideshow. Do you want us to present it?
Sure. If you have it readily available, it would be good to be shown. It can't be emailed to other people, but we can show it today.
Okay. Justin, do you have it ready, queued up, or no?
Ben, in full disclosure, this is being recorded. Is that okay?
Yeah, that's fine.
Even if we show slides, it can be recorded?
Yeah, because
that'll be all right.
Okay.
And I can start talking just in the interest of saving time. And if you have it up, you can just, catch up to me.
Okay.
All right. So first, I just want to thank Ron and thank Niagara Pride for inviting the Social Security Administration to speak today and share information about some of our benefit programs and information about how to do business with Social Security during the pandemic. My name is Ben Stump, and I'm a public affairs specialist. I'm based in the Buffalo and Niagara Falls Social Security offices, but I also represent all of the 27 Social Security offices spread out across upstate New York. I've worked for this agency for just short of 30 years, and the last 6 of those years have been in public affairs doing this job. I just want to let you know before I get started that I will be giving out some email and website addresses. So if you're not taking notes, I just want to make sure you have some paper and something to write with handy, just in case I give some contact information you might want to jot down. So in the past, before coronavirus, when I would participate in events like this, I was usually asked to talk about retirement benefits. That's because when most people think of Social Security, they probably first think of retirement, and for good reason. Retired workers and their dependents account for about 73% of the total benefits we pay, which, in case you're interested, is over $1 trillion. That's trillion with a T, a year. But we also pay benefits to people with disabilities, and we pay benefits to survivors of deceased workers. And then there's this program called Supplemental Security Income, or SSI, and I'm usually not asked to speak about SSI, but I wanted to focus on that today. And is the slide up there?
Yes, it is. Yep. We have the
Awesome.
SSI slide. Yep.
Are you looking at what looks like blue wallpaper?
We are on the next one, I believe, where it says the Social Security, like it defines what it is, who's eligible.
Oh, okay. I think
Yep.
that'll work. Okay, so I just wanted to spend the bulk of my time today talking about SSI because it's a program that's based on need, meaning you need to have very limited income and resources to qualify for these benefits. It's meant for people in need and often the most vulnerable people in our communities. So we've seen a steep decline in SSI applications over the past several months since the beginning of the pandemic. So Social Security is making an extra effort to reach people who may need SSI because right now our offices are open to the public only for people with appointments, no walk-in traffic. And typically in the past, the people who receive SSI or apply for SSI have been people who just walked in that day. So we're doing a lot of business right now over the phone and by internet, while most of our employees continue working from home like I'm doing right now. So we're concerned that we're not able to reach the people who possibly need us the most. So we've actually launched an initiative last month. So if you're on today's call representing an agency as a community provider, and if you were interested in partnering with Social Security to help reach potential SSI applicants, your agency would be one, hopefully, that would reach one of the groups that we're most interested in contacting, and that's people experiencing homelessness, senior citizens, veterans, recently incarcerated people re-entering the community, people with limited English proficiency, children with disabilities, and people diagnosed with mental illness. So if you work for an agency, if you're representing an agency today that works with those different communities, you might be a good partner to work with us. You'd have to be willing to take SSI applications or provide us with enough information so we can contact the potential applicant to establish a lead or a protective filing, or at the very least, be willing to refer your clients to our 800 number to make an appointment. And if you are able to partner with us, we will create a special workflow between your agency and ours, and that may include putting you in contact with a designated liaison in the closest Social Security office to you, and we could create a secure email connection between our agencies, and we would provide you with full training. So if this is something that you're interested in, you can email me at it's just my name, ben.stump@ssa.gov, ben.stump@ssa.gov. And Ron, what slide are you showing right now?
More information and how to contact.
Perfect. So I think I mentioned in order to get SSI, you would have to show that you have limited income and resources. There are two categories, two groups of people that we pay the benefits to: people age 65 and older, or people who are blind or have a disabling condition that prevents them from working for at least 12 consecutive months. And we also pay SSI benefits to children. So if you're interested in more information about SSI or just in general how to get in touch with Social Security, the slide that you've been looking at shows some different publications that we have available at socialsecurity.gov on our website. The SSI spotlights are sort of like fact sheets that sort of focus on specific topics related to SSI. And then there's a list of different SSI related publications that you can view, download, and print from home. And then that second part at the bottom of the slide, if you just like general information about SSI, or if you need to get in contact with Social Security for any reason, you could call us at 1-800-772-1213 or visit us at www.ssa.gov /SSI if you want to go directly to SSI information. And if you need to contact your local Social Security office, again, go to our website and use the field office locator. at ssa.gov/locator. You just put in your zip code and it will bring up the information to contact the office that's closest to you. And lastly, if you are helping someone who has a critical case or is in dire need, limited critical situations, and you've been unable to contact a local Social Security office, our regional communication directors are offering to step in to kind of facilitate the communication. So you can contact the regional communication director in your area directly. And there's a list of RCDs available online at ssa.gov/agency/rcds.html. And Ron, can you advance the slide?
Yep.
So you should be looking at the homepage for the Social Security website. Because I've made so much reference to our website, I just wanted to show you what it looks like. We're kind of proud of it because I think a lot of people, when they hear government website, they think, I don't know if you've seen New York State, probably shouldn't throw another government agency under the bus, but if you've seen some other government websites, they're pretty dull. We've actually won awards for our design. It's meant to be user-friendly and interactive and engaging, and it's very easy to navigate. Across the top, you can see where you search with keywords or the menu for different topics. But I really want to bring your attention to the bottom left-hand corner where it says My Social Security. If you click that button, and Ron, you can advance the slide, please. You'll come to the page where you can create or access your own My Social Security account. This is something that we recommend for pretty much everybody, every adult at least. And Ron, you can move the slide up again. You should be seeing a list of My Social Security services.
Yes.
For anyone who isn't currently receiving benefits right now, once you create your My Social Security account, you can view estimates of benefits that you could get in the future. You can also request a replacement Social Security card if you meet certain requirements. You can check the status of your application or an appeal if you recently filed something. And if you ever needed to prove that you're not getting Social Security benefits, you could get a letter from your My Social Security account doing that. And you would also have access to your Social Security statement. And that's, if you remember, we used to mail out once a year of a form that was on white paper with green, I think it was green ink. This is your Social Security statement, and you have constant access to that with a My Social Security account. And Ron, could you move to the next slide? If you are receiving benefits already or have Medicare, a My Social Security account can do even more things for you. Because we're kind of making it easy for people to do things self-service style from their own computer, so they don't have to visit us in the Social Security office, and that's more important now than ever. So you could opt out of getting mailed notices if you'd prefer to read them online. And again, you can request a replacement Social Security card. You can report wages if you're getting benefits, disability benefits, and you're working. And I won't go through everything, but basically changing your address or your direct deposit information, a replacement Medicare card can be requested, and you can even get an SSA 1099 form to file taxes. And we keep moving more and more things over to this portal to make it a little bit easier for people to do things on their own. But you can maybe see how this is helping a lot of people who are getting retirement benefits and Social Security disability, but say that our homeless population, some people who are getting SSI benefits just aren't able to take advantage of these services we're offering, which is why I focused on SSI so much. And Ron, could you move it to the next slide? Just want to give a quick reminder that you can assist someone in creating a My Social Security account if they are physically with you and they have their own email address, and they can answer what we call out-of-wallet questions. That means questions that come from your credit report. So you might see a multiple choice question, such as which of the following financial institutions did you open an account with in the last 5 years? So anyone creating an account has to answer those types of questions. And just a reminder that you cannot create a My Social Security account on behalf of another person, even if you have that person's written permission. And an example I like to give is financial planners cannot open My Social Security accounts for their clients. And then Ron, if you want to just advance the next slide. One last place to go for good information from Social Security. A lot of people are surprised to learn that we have a social media presence. Our Facebook page is very popular, probably the most popular social media platform we use, though a lot of people like to look at our videos. We have some things like retirement seminars and things like that on YouTube. Just a word of caution using social media and us. We always display a little blurb in our official seal, and it will say this is the official Facebook page of the Social Security Administration, something like that, because there are some lookalikes and some fakes out there. So, we always have to be aware of scams today. So when you interact with us online, anywhere, just make sure you see something with our seal and saying that specifically that it's us. And then Ron, if you want to just advance, do you want me to hold off questions for the breakout sessions?
Yes, please.
Okay, will do.
Perfect. So Ben, thank you. That was a really good presentation, really informative, and especially about something that we don't normally hear, which is the SSI component to Social Security. So that was really good, as well as that partnership that you're looking to do with other community providers. I think that's a great step for Social Security Administration to do that. So thank you for sharing that information. And I will say that as a former public affairs officer for another federal agency who did not win awards for web design, I am very jealous of SSA's website. So thank you, Ben.
Thank you for the compliment.
No problem. So next on our list of presenters is Anaya Wolf. I hope Anaya Wood. I hope I'm pronouncing that correctly. So.
Hi, my name's Anya Wood.
Anya Wood. All right, sorry.
That's okay.
So you'll be presenting from Evergreen Health regarding the Trans Health Initiative, if I'm not mistaken.
Yeah, so it's I'm the linkage specialist for the Trans Healthcare Services Program. So it's an AIDS Institute funded program that allows us to work with our transgender patients and gender nonconforming patients who are living with or at risk of HIV. So it's designed to have about 50 to 100 people, trans people who are mostly people of color who are living with or at risk of HIV, all ages, all genders, but sort of prioritizing people who are living with HIV and have more immediate needs, or people who are on PrEP or doing sex work or homeless or recently incarcerated, that sort of thing, where things like PrEP and more routine STI screenings would be helpful. And we sort of work to, myself and my coworker, who's a medical case manager, we work to link patients to the appropriate services. So we have that sort of specialized and localized program at Evergreen and we're the actually only program that does that service outside of New York City, the New York City area. That has a sort of specialized program for trans people living with HIV. And but we also work with all around 700 to 800 or so, I think that's the last number I got, was trans and gender nonconforming patients of Evergreen. So regardless of their HIV status, whether they're on PrEP, what their sex life looks like, we help them with any and all medical case management needs. So oftentimes that looks pretty similar in terms of the linking to appropriate services. The needs are pretty similar in terms of most, if not all, of our patients are looking for either some kind of surgery or a legal name change. So that's a pretty common thing that we work with. We have really strong relationships with local surgeons' offices, plastic surgeons, urologists, all that sort of stuff who do gender affirming surgeries, top and bottom surgery, along with we are working on building stronger relationships with local voice therapists and sort of like laser hair removal electrolysis clinics. So really just in order to coordinate the best level of care that we can for patients and remove a lot of the sort of like barriers and hassles that trans people have to overcome in order to just access care. So we, as people might know, if you don't know, Evergreen is a primary care clinic. It was started as an HIV clinic in the 80s, and we've grown to have primary care and our own STI clinic. So on top of routine primary care, which we have about 7,000 patients enrolled in, we do offer hormones as a specialty care, as well as hepatitis C treatment and HIV treatment. There's lots of different programs in Evergreen outside of primary and specialty care, such as like housing, care coordination, support groups for people living with HIV. We now have a dental clinic. So it's growing very quickly, but we still do have a strong base in like the LGBT community and do really prioritize the healthcare needs of trans and gay and queer people. So in terms of, so part of the grant also we do offer other sort of services. We do like a monthly group that's over Zoom currently. It's kind of like a support group, for lack of a better sort of term. But it's just kind of a group where people can share experiences. The goal was pre-COVID to do a group around like skill building and that sort of thing, about like building a resume or that sort of stuff. But these days it's become much more of like a sort of support group to just talk about people, like what people are going through with COVID and all that's gone on in the past year. So besides like the surgeries and name changes, it's also a lot of like linking people to like we work in the clinic, so we see patients at annuals, follow-ups, injection appointments, STI appointments, all that sort of stuff. Like I said, we have a really strong sort of foundation in HIV and PrEP, and working with those patients and addressing those needs, but we are very confident in referring patients elsewhere for other sort of needs. So a lot of people need to see like a urologist or a gastroenterologist or endocrinologist for various sorts of reasons. We're working on developing stronger relationships with a lot of mental health clinics in the area, and hoping to do more like not so much cultural competency, but just like how to. So for surgery specifically, you need a mental health letter, as well as usually a psych letter for any kind of gender affirming surgery. So we're trying to work more with mental health providers, especially the bigger name sort of agencies in the area in Western New York, to educate them on how we write the letters and what insurance needs to, in order for them to approve the surgeries. So that is pretty much the question. I'm trying to think if I missed anything, but that's pretty much it.
Perfect. Thank you. It's I know Evergreen has expanded, and sorry, that is my dog shaking its collar in the background, that noise. Evergreen has, I know, expanded over the years, and just offers a phenomenal amount of services nowadays. So it's a really great resource in the community. So thank you, Anya, for the presentation. So thank you for all that info. And last but not least, Alan Booker will be presenting with regards to Booker College Planning Services.
Yes. Well, thanks, Ron, for inviting me. And I want to thank Niagara Pride. I also want to send a shout out to Cassandra and Brian. I know those guys very well. We've done a lot of work, so I'm glad you're on the call. And honestly, I'm very happy to see everybody else on the call. I learned a lot more today. And just because I'm a college planner doesn't mean that I also could share this information with some of my clients, because we talk about other stuff as well. So I'm happy to hear this. So again, my name is Alan Booker, and I'm the founder of Booker College Planning, which is located here in Niagara Falls, New York. And I've been in business for about 14 years now, which is hard to believe. Kind of just the years just keep going by faster and faster. I specialize in really helping students and families navigate the college planning process, primarily high school juniors and seniors, but I have worked with sophomores and freshmen once in a while, just to, they come to me and I kind of give them some advice, but it's primarily the high school juniors and seniors that I really work with. And some of the things that we work with regards to the college planning process would be things like the college application deadline, because many of us who've gone to college, or people who've gone to college, that application deadline is key so that you don't miss out on anything. We also work with students and families on just the entire college planning timeline itself. So for example, there might be something due this month in November, December. So we have to make sure that we have the students stay on track with a lot of that. We also work with students on their essays. And I'm going to say this, we do not write essays for students. That is something we do not do. What we do is we review them, we give them advice. We may talk about how they're communicating themselves through the essay, because when students are turning in the full application, they are trying to give a representation of who they are, because college admissions people don't know who you are. So you need to turn in all this paperwork online so that they can kind of get a sense of who you are and if you're going to be a good person for their school. We also work with them on high school brag sheets, meaning what have they done besides academics outside of the classroom? And that could start as early as 9th grade, and that can end as early as the senior year and beyond. So we want to capture all of that. So students can focus in on their leadership skills, if they've played sports, if they've done some community work, all of that stuff plays a big part in their brag sheet. We also prepare them for virtual open houses, because right now, as we know, unfortunately, we're in the middle of a pandemic, and going on campus to visit, which is always the rite of passage, is not an option right now. So a lot of colleges have pivoted their open house programs so that they can have students sign on and do the virtual tours. And quite frankly, a lot of them are really, really good. So it gives an opportunity for students to just sit at home and just kind of tune in on their phone or their laptop or their desktop or what have you. And they can chat with people. So a lot of students are getting used to that. And we also work with them on their scholarship applications. And just in full disclosure, I am not a financial aid advisor, neither do I want to be one ever, right? Because it's a lot of work, it's a lot of detail, and that's just not my area. But if people do come to me for financial aid, I usually refer them back to the colleges that they're going to be applying to get that information. But in reference to the scholarship application, it's really just helping them read through it and determining exactly what type of information they need to submit in order to hopefully get that scholarship. So it could be as easy as submitting an essay. And by the way, you would be surprised how many students don't want to do the essay. And I'm saying, well, if you do the essay and you win, that could be $1,000, $2,000. And that will go a long way with trying to at least buy you some books and some other stuff that you need for college. So we work with them on that and other stuff. So it just depends on, the particular student and their individual needs. So there might be other things that may crop up along the way. So we kind of navigate that. Kind of doing a circle a little bit. So has the college admissions process been impacted by the pandemic? And the answer is absolutely, because now things that were sort of quote unquote normal in the college admissions process, like the timeline and campus visitations and all the stuff that students will do to prepare to go to college, they've been disrupted. So a lot of the colleges have been very generous. They've been very appreciative. They've been very just working with students to help them navigate all of that. Because think about it. High school students are already online like this right here, and they're doing this every other day or however the school has it worked out for them. And then they have to sign into another thing. So they're exhausted by this. But within the college planning process, I assure them, I said, you know what, you could still apply. We just have to do things slightly different, but we will still hopefully accomplish the same goal. So that's a big thing. And one thing, this is kind of a sidebar that I've noticed, and I think a lot of us have noticed, the lack of access to technology. So I've had students who they had to log in on their cell phones because they may not have a laptop or a computer or what have you. So we had to navigate around a lot of that stuff. So hopefully it's going to get better because education, we just have to do better. So other than that, that's really kind of a synopsis of what I do. I enjoy what I do. And right now, as far as seeing people, I'm doing it virtually for now. And if you have any questions, you could definitely give me a call. And I'm going to put everything in the chat box. And I'm also going to be around in the breakout room if you have any additional questions. But I'll put all my contact information there. You can go to my website at www.bookercollegeplanning.com. That'll give you all the services that we offer and kind of a little bit of the process. And again, I'm glad to be here today to share my business and what I do. And like I said, I enjoy helping students. I've also helped adults from time to time because, hey, students don't just want to go back to school. Adults want to go back to school as well. So I'm there to help everybody as best as I can. So thank you.
Very cool. Thank you, Alan, for that. That was some good information as well. And Brian's giving you the thumbs up as well. So he really liked that. I think Brian's probably going to want to go back to school as well. So right now, let's take a few minutes. Justin will do the breakout rooms. I'll say let's spend about like 5 minutes in the breakout rooms, and then we'll pull everybody back. So if anybody goes to a breakout room and has questions, feel free to ask the presenters about their programs or any other information that you'd like. We'll come back in the last 5 minutes of the presentation, and I'll talk about some upcoming events for Niagara Pride so that everyone is aware of what's going to be coming up in May as well as for Pride Month. So just